Hello.
Hi.
How are you?
I'm good. How are you?
All right. My name's Beth Martin. I'm going to be your registered nurse today, okay? I'm going to start with just asking you some general questions. We're just going to talk about your general health, your health history, your nutrition status, your mental status, and do some vital signs, okay? It should take about 25-30 minutes, okay? All right. Can you tell me your full name?
Samantha Joe Page.
Okay. Do you have a name that you like to go by?
Joe.
Joe? Okay, that's a great name. All right, how old are you?
I'm 21.
All right. When's your date of birth?
2/14/1996.
All right, Valentine's. All right, are you in a relationship, single, married?
In a relationship.
Okay.
Not married.
All right. Okay. What's your education level? What's the highest you've been?
Associates in college.
Okay. Are you currently in college now?
Yes.
Okay. What type of program?
RN.
Congratulations. Good luck.
Thank you.
All right. Do you have a job?
There.
Okay. And what type of job do you have?
A waitress.
Waitress. Okay. Is it stressful?
It can be. It's only 2 days a week though.
Okay. And how long have you been a waitress?
5 years.
5 years. All right. Okay. So what brings you in here today? What makes you come see us?
Just a general checkup.
All right. So what would you describe health as?
State of body and mind being disease free and stress free.
Okay. All right. All right. Do you have any current concerns or complaints right now?
Not really.
Okay.
I get nauseated in the morning sometimes. That's about it.
Okay. So how long has that been going on?
A couple months.
Okay. Does anything make it worse or better?
Eating makes it better.
Okay. And do you take any type of medication for it?
Not for the nausea though.
Okay. All right. So we're going to go over your childhood and past history. If you don't remember, it's okay. Just let me know. If you don't know exact time or dates, just kind of gauge if you want to. All right. So as a child, do you remember if you had any sickness or illnesses?
I started precocious puberty.
Okay.
I had my adenoids taken out. I had tear duct surgery, and I think I had pneumonia as a baby.
Okay. All right. So pneumonia as a baby. You remember how often or how many times? Was it like recurrent? Or?
No. I think I got double pneumonia as a baby. I think.
Okay. Did you have medication for it? Do you remember they said, or hospitalized, or?
I think I was hospitalized. I think I was really, really little baby, like a infant.
Okay. All right. And you said you had clogged tear ducts.
Yeah.
Okay. What did they have to do for that?
I just remember they had to have surgery to get them unclogged.
Okay. Remember about how old you were when that happened?
Probably 1 or 2.
Okay.
I was still really little.
All right. Do you know who did the surgery? All right. And precocious puberty. So how old were you when that happened?
I started pre-K.
Okay. And how did that make you feel?
As I got older, I was always bigger than everybody else, so I had to deal with bullies and stuff like that.
Okay. All right. Now, did you have treatment for that, or?
Yeah. I remember they put me on birth control, and I had to get a shot every day.
Okay.
In my butt.
Oh, wow. Did you go to a specialist for this? Okay. Do you remember who that was? Okay. And how long did that treatment last?
I think they stopped around the age where I was supposed to start puberty.
Okay. You remember what that was? Age?
Probably 11 or 12.
Okay.
I think.
All right. Have you had any serious or chronic sicknesses before now? Okay. I know you said as a baby the hospitalization for the pneumonia. Any other times you've been in the hospital for anything?
No, I had surgery on my elbow.
Okay. What elbow?
The left one.
Alright. And why did you have surgery?
I broke it. And my radial head had to be replaced.
Okay. How old were you when that happened?
I was 17. I was a
Okay.
senior in high school.
Alright. How did you break it?
Softball.
Oh, wow. Okay. Alright. So you had surgery whenever you broke your elbow. Okay, as a senior. You said they cleared your tear ducts. That was a surgery. Okay. You said you had your adenoids taken out. Alright, you remember how old you were when that happened?
Preteen.
Okay.
Probably 12, 13.
Do you know who done that surgery? Okay.
I don't remember.
Remember having any problems with it? Okay. Any problems with any of the surgeries afterwards? Okay. With your elbow, did you go through like physical therapy? Okay.
Weeks of it.
Okay. And did everything heal like it needed to? Did you get range of motion and stuff back from?
For the most part, my arm won't straighten all the way out completely. And sometimes it'll hurt when I wake up in the mornings.
Okay.
That's about it.
Okay. Alright. So I know you said in pre-K that you had precocious puberty. So now do you have a monthly cycle? Is it regular?
For the most part.
Okay. Do you take any medication for your monthly cycle, or
I'm on birth control.
you are? Okay. Do you know the name of it right now? Okay. Is it one that you take daily, or?
It's a pill.
Okay.
Pill back
And do you take it every day, kind of compliant with it?
in the mornings.
Okay. And you take it around the same time every day? Okay. Now, as a child, do you remember, are you up to date on all your immunizations and shots and vaccines?
Yeah.
Okay. Have you had the HPV vaccine? You don't know?
Actually,
Okay. Alright. But we can pull it up and look in the system and see if you've had it or not, okay?
Okay.
That's a vaccine. It's like a 3 shot vaccine, and it's for the papillomavirus, okay? When's the last time you've been to the doctor?
I went, what's today? I went Thursday. Wednesday. Well, Wednesday.
Okay, so about 3 days ago.
Yeah.
And what'd you go for?
Adderall refill.
Okay. Alright. And who does that for you?
So Dr. Prasad's office. My doctor is Dr. Pamela. She's a nurse practitioner.
Okay. How long have you been going there?
Over a year.
Okay. And why do you take the Adderall?
For school. Help me focus. Study.
Okay. And you've been on that for how long?
A year.
Okay. What's the strength?
15 milligrams.
Okay. Do you take it every day?
Twice a day.
Okay. Do you ever go days that you don't take it?
Sometimes on the weekends.
Okay.
And sometimes when we have clinicals for school, I'll forget to take it in the mornings.
Okay. Do you have any type of side effects from Adderall?
No, it decreases my appetite some. That's about it.
Okay. Alright. Are you allergic to anything?
I'm not living around.
Okay. No food, no allergy to food, medication. Okay. Any type of insect bites? Nothing like that. Okay. Alrighty. I know you listed that you were on birth control.
Mm-hmm.
And how long have you been on that?
Over a year.
Okay. And you said it was a daily medicine in the morning.
Mm-hmm.
And you said you were on Adderall. What dose was that?
15 milligrams.
Okay, you said twice a day.
Mm-hmm.
And you said for about a year. Okay. Any other medicines that you take?
What's up on
Multivitamin?
Mhm.
Okay. Is that over the counter?
Yeah.
Okay. And it's like one pill daily?
Yeah.
Okay.
Usually take it in the mornings.
You have to take it with food or anything?
Yes, I know that now. I have to take it with food. That's what was making me nauseated in the mornings.
Okay. So
Because I wasn't taking it with food.
okay.
Yeah.
So has the nausea resolved since you
Yeah.
started taking it with food?
Yeah.
Okay. All right. How long have you been taking a multivitamin?
About 5 or 6 months.
Okay. All right. Any other over-the-counter medications that you take for anything? Okay. Any herbs or spices or oils or anything that you do for health or anything? Okay.
Not with some cooking.
Okay. All right. I'm going to take your vital signs right now, okay? And that's just going to take a minute. All right. First, I'm going to take your blood pressure. I need your feet flat on the floor, please. Just going to put this on your arm. And it's going to get tight a couple of times, okay?
Okay.
If it's too tight or hurts, just let me know.
Mm-hmm.
Okay? Blood pressure's 110/72. It's very good blood pressure, okay? I'm just going to listen to your heart and take your heart rate, okay?
Okay.
Okay. Alright, your heart rate's 72. Respirations are 18. I'll stick this in here and take your temperature, okay? 38.4. Good job. Alright. Do you have any pain anywhere?
I have a little back pain sometimes.
Low back pain sometimes? Okay. What causes that pain?
If I sit in a chair without back support for a long period of time, if I pick something up without bending my knees.
Okay. How long have you been having that?
Like, year and a half, 2 years.
Have you ever had an injury to your back?
Yeah. When I was in my first year of college, I played softball, and I had muscle back pain in my lower back. It got so bad that I couldn't hardly sit down without severe pain. And I had to go to the doctor, and my muscles were all knotted up. They had to give me muscle relaxants for about a week.
Okay. Alright. So describe the pain when you have it.
It's dull and achy.
Okay. Do you take any medicine for it whenever you have it? Okay. What makes it better?
I straighten it up. Sometimes I'll do stretches, stretch it out.
Okay. What makes it worse?
If I slump or keep sitting down, if I keep moving after it starts hurting.
Okay. So what's the worst if you had to rate it on a scale of 1 to 10, with 10 being the worst pain ever, 0 being no pain? What's the worst it's ever gotten?
About 5.
Okay. And what's the best it's ever been?
0.
Okay. Alright. So are you in any current pain right this moment while you're here?
No.
Okay. Alright. I'm going to give you 4 words, okay? And after I give them to you, I'll ask you at different points in times to repeat them back to me, okay? Alright. I'm going to give you latitude, okay? Elephant, orange, taco. Okay. Can you repeat those back to me now?
Latitude, elephant, orange, taco.
Okay. Alright, we're going to ask you about your family history. Okay. Does anybody in your family have any sickness that you know of just off the top of your head?
Stepdad has high blood pressure.
Okay.
Nobody else that I know of.
Okay. Alright. Is your mom living? Okay. Is your biological dad living? Okay. I heard you said stepdad, so okay. So does either one of those have high blood pressure, diabetes, heart problems?
Not that I know of.
Okay. Any type of cancers?
Mom had cervical cancer.
Okay. You know if it was treated?
It was.
Okay. Alright. Do you have any brothers or sisters? Okay. How many brothers and sisters?
I have one brother, sister that are half brother, sister, and then I have a stepsister.
Okay. Do either one of those have any problems? Asthma, high blood pressure, diabetes?
My older brother has asthma.
Okay. Does it require treatment?
It's every now and then. It's not constant. It's only when it acts up. And I think it has gotten better.
Okay. Alright, now I'm just going to ask you some questions about your overall systems, body systems. Okay. Alright. We're going to go over your skin. Do you have a history of any type of skin disease, eczema, psoriasis, hives?
Mm-mm.
Okay. Do you itch anytime? Have any bruising? Any rashes anywhere?
No, not really. My legs will itch sometimes after I shave. That's about it.
Okay. Alright. How much sun exposure do you think you get?
I get probably maybe an hour every day at least. Sometimes 30 minutes to an hour every day at least. Sometimes more on weekends.
Okay. Do you use any type of sun protectant?
No, not unless I go to the beach and I'm in the sun for a really long time.
Okay. Alright. It's recommended that you use it every time that you go out just because of the radiation's getting worse, okay? Alright, any type of moles or lesions or cuts or anything on you that you are concerned about?
I have a mole right here
Okay.
that I always keep watch on.
Okay, does it change shape or color?
What I've noticed.
Okay, any pain to it?
Mm-mm.
Okay. Alright. Your hair, have you had any recent hair loss? Change in the texture? Okay. Nails, how are they? You got any change in the shape or the color?
Mm-mm.
Are they usually very brittle, easy to break, or?
I'll bite them or like tear them a lot. Let
Okay.
the tip off.
Okay. Alright, do you have any frequent headaches, or have you ever had a head injury, type of dizziness?
No frequent headaches.
Okay, where do you have headaches at?
Sometimes it'll be here, sometimes here. I have had them just kind of all over before. It's all in one.
Okay, how often do you think they come?
Every day.
Every day?
Sometimes twice a day.
Do you take anything for them? Medicine?
Just Tylenol, ibuprofen.
Okay. Do that usually help resolve them completely, or?
Yeah, usually.
Alright, describe the headaches.
Just achy, dull. Every now and then there'll be a sharp pain.
Okay, where's the sharp pain? Is it in one area?
Yeah, it's usually here.
Okay. What are you doing when you start having these headaches? Anything in particular?
They just come on.
Okay.
Just random times of the day.
How long do they last?
If I don't take any medication for it, they'll last until I take medication for it.
Okay. Alright. And how long have you been having them?
About a year since I started school.
Okay. Alright, do you wear, have any trouble with your vision? Do you wear glasses or contacts?
For glasses.
Okay. How long have you been wearing glasses?
A few years. Probably 3 or 4
Okay. Do you have any, when's the last time you went to the eye doctor?
this year.
Okay. Do you know who that is, or where do you go?
My eye doctor in 6th grade. I don't know the name of the doctor then.
Okay. And do you go routinely kind of on time for your eye exams, or do you miss times in between, or?
Well, this past year is the first time I went in a couple of years, so I wouldn't say I go every time.
Okay. Alright. Now, do you have any type of blurring or eye pain?
They're like far off will be a little blurry, but
Okay.
not so much as where I can't function.
Okay. Do you ever have any redness or swelling or watery eyes?
I look at watery sometimes.
Okay. Alright. Do you ever see double vision or anything? Okay. How do you see at night? You drive? Okay. Okay. Alright. Your ears. Have you had any recent earaches or infections? Ringing in the ears?
Bringing in the ears sometimes.
Okay. Do you have that very often?
Not very often. I'd say maybe once every few days or once every week or.
Okay. Are you exposed to like very loud noises a lot?
Yeah, car.
Okay. So you listen to the radio loud?
Mm.
Alright. You do that a lot?
Every day.
Okay. Alright. You remember those 4 words I told you a while ago?
Longitude. What was latitude? The elephant, orange, taco.
Okay. Okay. Alright. Do you have any sinus trouble? Any recent colds? Do you have nosebleeds? Okay. Any allergies? Do you get like hay fever, coughing, sneezing during certain seasons?
Not usually, no.
Okay. Do you ever have any mouth pain, sore throats? Do your gums bleed? Okay. You have trouble swallowing or hoarseness or anything like that? Okay. And you said you had your adenoids taken out, correct? All right. All right. Do you have any sores in your mouth or anything right now? Okay. All right. When's the last time you've been to the dentist? Do you go to the dentist?
Yeah, I went this year.
Okay. All righty. All right, your neck. Do you have any pain in your neck at all?
Not at the moment.
Okay. Do you have any like limited range of motion? Can you turn it, bend it?
Yeah.
Okay. All righty. Do you have your lymph nodes, or do you ever have any swelling, or are they swollen now?
That's all I had to say.
Okay. All right. All right, your breast. Do you do self-breast exams any? Okay. Which method do you use when you do that?
Feel. Circle.
Circle.
Around.
Okay. Have you ever felt any lumps? Okay. And when do you do that?
Before I got in the shower.
Okay. All right. Any lumps or swelling or hurt kind of under here? Ever? Okay.
Never noticed.
All right. Do you have a history of asthma, or I know you said you had bronchitis as a baby, but none since, right? Pneumonia. Not bronchitis.
But no, not any asthma or anything like that since.
Okay, tuberculosis. Okay. Do you ever, I know you said you're in the nursing program, do you take the TB
Yes.
test?
Little part.
Okay, when's the last one of those you had?
Last October, I'm due for another one this
Okay.
year.
Okay, and are they negative? You ever have like a chest x-ray after it or anything?
They've always been negative.
Okay. Do you ever have any shortness of breath or wheezing or chest pain? Alright. Okay. Are you around anybody that smokes?
No, my boyfriend vapes, but he doesn't smoke.
Okay. Do you smoke?
No.
Okay. Have you ever smoked? Okay. Alright.
Too scared to.
Well, it's a good thing. Stay scared. It's not good for you. Do you ever have any like palpitations? You feel like your heart's beating out your chest or anything like that?
Only when I exercise.
Okay. All right. You ever have any swelling anywhere? Never been told you had high blood pressure, coronary artery disease. Okay.
Blood pressure's always been low.
Okay. And what about anemia? Has anybody ever told you you had low blood counts? Have you ever had any blood transfusions? Okay. When you're on your monthly cycle, how much do you bleed, you think? Is it very heavy, moderate?
It varies.
Okay. All right. Do you ever have any coldness or numbness or tingling to your feet, legs, or hands, arms?
My hands stay really cold.
Okay.
And if I cross my legs or sit like this, I'm gonna feel it numb.
Okay.
Or if I lay on my arm when I'm laying down, it'll go numb. But other than that, no.
Okay. Well, they don't recommend that stand or sit for very long periods of time. Okay. All right. So range of motion is very often. Okay. All right. What about your appetite?
I usually eat about 3 times a day.
Okay. Do you eat full meals?
Sometimes.
Okay. So what have you eaten in the last 24 hours, you think?
I ate a bowl of cereal this morning. I ate a donut last night. I ate a small cup of salad yesterday at work before we started, and I ate half of a cheeseburger and a sweet potato last night when I got off.
Okay. Do you drink a lot of sodas, teas?
I drink lots of tea.
Okay.
I try to drink water, but I don't know.
Yeah, about how much water do you think you drink a day?
Anywhere from 2 to 6 cups a day, depending on how often I'm drinking.
Okay. Do you ever have any trouble swallowing or any pain after you eat or burning after you eat? Any stomach pain, diarrhea, constipation?
If I eat fried foods, it messes up my stomach. And if I eat Mexican food, it messes up my stomach sometimes.
Okay.
I try not to eat a lot of fried food.
All right. How is your bowels? Do they move regularly? All right. What about your urinary system? When you urinate, do you ever have any burning or frequency or increased frequency, pain?
It's pretty regular.
Okay. Do you have trouble urinating? Do you have accidents where you, maybe when you exercise or anything, that you notice that you've had any type of accident, leak, or anything? Okay. Have you ever had a urinary tract infection? When was the last time you had one of those?
Well, see. It's a little over a year ago.
Okay.
I had a UTI and a yeast infection at the same time.
Okay. All right. We've already talked about your menstrual history a little bit. Okay. Any other type of vaginal discharge or anything? No. Okay. Are you currently sexually active? Okay. Have you ever been pregnant? Okay. All right. Do you use any protection? Any type of protection besides your birth control? Okay. All right. Have you ever had a sexually transmitted disease? Do you know if your partner has? Okay. Do you have many partners?
No, it's just one.
Okay. All right. With your joints, I know you said you get stiffness or pain in your elbows sometimes. Anywhere else that you get that in any other joints?
My shoulder has been giving me problems lately.
Okay. Just one?
Yeah, my left shoulder.
Okay. And what causes that to get worse or better?
I mean, if I move it a lot, it'll start hurting.
Okay.
It'll pop a lot when I rotate it.
Okay. Have you ever been to the doctor for it? Had it seen about? Okay. You take anything medication-wise for it? No.
I just only recently started getting problems.
Okay. Any muscle pains, cramps, weakness? Okay. How much walking do you think you do a day? Is it just regular walking, or do you do like exercise walking?
Just regular walking.
Okay. All right. Do you have a history of any seizures or strokes or fainting? Okay. Do you have any like coordination problems? When you stand up, do you get dizzy or swaying, or when you go to pick up something, are you able to do it just by normal?
If I stand up too fast sometimes, I have to catch my balance.
Okay.
Or spin a little bit.
Okay. Do you ever get like nervous or anxious? Have any mood swings?
Not recently.
Okay. What about depression? Do you ever feel depressed?
Sometimes.
Okay. Do you ever feel like you want to harm yourself?
No.
Okay. Do you take anything for depression?
No.
Okay. You ever talk to a doctor or anything about depression?
No.
Okay. Do you know if depression runs in your family?
It does.
Okay. Who has depression?
I know my biological dad does.
Okay.
I don't know.
Okay. All right. Do you ever like have hallucinations, delusions, hear things that aren't there, or anything like that? Okay. All right. Do you ever have any bleeding anywhere? Excessive bruising? You ever had any like lymph nodes swell up? I know you said you didn't have any blood transfusions.
Not that, no.
Okay. All right. And do you have a history of diabetes, or have you ever been told you have diabetes? Okay. Do you have any excessive drinking? Thirst or eating or urinating?
No.
Okay. Do you eat a lot of sweets?
Not really.
Okay.
Very, very seldom, occasionally.
Okay. Are you able to tolerate heat and cold? Okay. Do you ever sweat excessively?
I've always sweated more than everybody else. Just kind of, I've always sweated a lot.
All right. Any tremors or anything? Okay. All right. Do you have trouble with your activities of daily living? Do you bathe every day? Any trouble while you're bathing? Okay. All right. And you're able to do it all by yourself? Do you cook your own meals? Okay. All right. And as you said, you was in college. And are you having any stress with that?
A lot.
Okay. What do you do to help with your stress?
Shooting the bow recently. Helps relieve it some.
Okay.
Nothing else really. I'll try to take a break from studying, but I usually work and study.
Okay. So you're going to school and you still work? Okay. All right. Do you have any financial stress? No. Okay. Do you associate with any type of religion?
Yeah, Christianity.
Okay. Do you have any stress that comes from that? Okay. All right. Do you have any overall questions or concerns about anything that causes you stress? Okay. Okay, what about your activities and exercise?
I used to be active before I started nursing school.
Okay.
I've tried to exercise some, but I don't exercise regularly right now.
Okay. Okay. When you do exert yourself, can you handle it okay? Do you get short of breath when you get exerted, or chest pain when you get exerted?
I'll get short of breath when I start out working out after a long time, but it usually gets better as my endurance builds up.
Okay. Alright. How's your sleeping? Your rest at night?
I mean, it's like okay, I guess.
So how many hours of sleep do you think you get?
Probably 5 or 6.
Okay.
I don't stay asleep.
You don't? You
No.
don't sleep straight through?
I wake up a lot.
Okay. About how often do you think you wake up?
I feel like a million times.
Okay. You ever wake up sweating?
Yeah, I wake up hot.
Okay. Alrighty.
I have to have a fan in my room running or something.
Okay. You ever take naps during the day?
Mm.
You get sleepy during the day?
All the time.
Okay.
Well, yeah, tired. Tired.
Okay.
More than sleepy.
Alrighty. Can you recall those 4 words again for me?
Latitude, orange, elephant, taco.
Okay. Okay. Not too much longer, okay? Alright, can you tell me about your nutrition? I know we've talked about it a little bit, but do you eat fruits and vegetables?
Mm.
Okay. Okay, do you have any alcohol beverages?
No, I might drink one every once in a blue moon, but I don't drink American really.
Okay.
I couldn't even give you a timeline. I don't drink them that often.
Okay. Well, when you drink, what do you drink?
Beer.
Okay. A lot at one time, just,
Maybe 1 or 2.
okay. Okay. Does anybody in your family have a history of alcoholism?
Yeah, my granddad did.
Okay. Alright. Who buys and prepares your food for you?
I'll buy some. My family usually buys most of it.
Okay. Alright. Do you have a lot of caffeine intake that you do? Coffee, Coke,
Just the tea,
just the tea?
usually. I'll drink, might drink like a can of Pib, every once in a while.
Okay.
But that's about it for the carbonated beverages.
Alright. How's your social life?
It's fun.
Okay. Do you, I know you said you're in a relationship. How long have you been in that?
Over a year and a half.
Okay. You ever feel like, he wants to harm you?
No.
Okay. You feel safe with him? Okay. Alright. Have you ever been in an abusive relationship? Ever?
No.
Okay. Alright. Do you feel like you have good support from your family and friends?
Yeah.
Okay. Do you ever go out and do anything besides study and work? Do you do anything socially?
No. I might go to the movies every once in a while, but not lately anyway.
Okay.
Okay.
Alright. If you had a problem at work or school, who would you go to? Do you have somebody you could go to talk to about it?
Yeah, my mom.
Okay. Alright. If you had a personal problem, you have somebody you can go to about that too? Okay. Alright. I know that you said you had stresses, and that you have, different ones between school and all. Do you have a certain way that you cope with it?
Pray.
Pray? Okay. Alright. Do you have any, do you feel like you get more hungry when you're stressed out? Do you eat more when you're stressed out?
No, I usually eat less.
Okay. Alright. Alright, we've talked about your personal habits a little bit, your alcohol, smoking. You said you don't smoke and you
That's
rarely drink alcohol. Okay. What about any type of street drugs?
No.
Okay. In the past, have you ever done any type of street drugs, marijuana?
No.
Okay. Have you ever been kind of tempted or asked to do any type of street drugs?
Mm.
Okay. Pressured is what I was trying to look for. Sorry.
No.
All right. Okay. Do you live in an area where you feel safe? Okay. Do you have good transportation? Do you worry about transportation
No.
anywhere? Okay. All right. Do you have any hazards or anything in your workplace? Do you feel like it's a safe environment?
Yeah, I mean, safe environment.
Okay. All right. Do you feel like there's any type of pressures or any concerns you have at work?
My boss is very stressful.
Okay. How do you deal with that?
I either bite my tongue or I lose my cool.
Okay.
Depends on what kind of day I'm having.
When you say you lose your cool, what do you do?
I throw a fit and tell them what's on my mind.
Oh, okay. Does it ever turn into physical
No.
violence? Okay. Do you ever get to the point that you do threatening violence?
No.
Okay.
Never threat, just state the common sense stuff that should have been stated.
Okay. Okay. Can you repeat those 4 words for me again?
Latitude, elephant, orange, taco.
All right. How do you feel today?
I'm a little tired.
A little tired? Okay. How do you usually feel?
I'm tired.
All right. How do you think people treat you?
Fine.
Okay. Do you feel like other people talk about you?
No.
Okay. Do you feel as if you're being watched or followed or anything like that? Okay. Is your imagination like very active? Is your mind kind of working all the time? And
Yeah, I guess you could say that.
okay. Have you ever heard somebody call your name when you're alone?
Yeah.
Really?
Yeah, actually.
Okay. Do you know what caused it or?
No, it's probably because I was in a lot of stress. It was during a very stressful semester of nursing school.
Okay.
So I was probably really going a little crazy.
All right. Did any other experiences happen?
No.
Okay. All right. Over the last 2 weeks, how often have you been bothered by the following? Okay. Have you been feeling nervous, anxious, or on the edge?
Yeah, it was just with school there. Just I'm fine now as I was.
Okay. Have you been to the point where you hadn't been able to stop worrying?
Not recently.
Okay. All right. Well, what are your future goals? What do you plan on doing?
Graduate nursing school in December, go for my bachelor's next August, and eventually in the future be a nurse practitioner.
Okay. What about like family life? You have any family goals?
Yeah, married eventually
Okay.
in the next few years.
Okay.
No time soon.
Okay. All right. Alrighty. Over the past 2 weeks, have you ever felt where you were depressed or hopeless?
Depressed.
Okay. Have you felt like you've been kind of withdrawn, not really wanting to do much that you normally would have done?
Yeah.
Okay. Have you ever spoken to anyone about this?
No, I just usually deal with it.
Okay. How do you deal with it?
Just wait until it passes and
Okay.
Go back to doing what I do.
Okay. And you've never, or have you ever felt so blue that you just felt like you wanted to hurt yourself?
No.
Never?
Mm-mm.
Okay. You ever felt like you wanted to hurt anyone else?
Mm.
Alrighty. If something was to happen to you, do you feel like people would miss you?
Yes.
Okay. Alrighty. Well, I'm going to ask you to stand up, and we're going to get your weight, okay, and your height, and I'm going to measure around your waist, okay? All right. Okay. Can I get you to stand on the scale, please? Look straight ahead. All right. Okay. Can I get you to stand against feet flat? Okay. All right. Step out. Okay. All righty. Okay. And I'm gonna check around your waist, okay? All right, I'll lift your shirt just a little bit. Alright. Well, I think that concludes everything. Do you have any questions or concerns of anything we've talked about today? Okay. I would recommend, that you kind of limit your tea, your caffeine intake, your sugar intake, okay? I'd recommend probably trying to incorporate exercise more, walking, maybe even some meditation, quiet time to help with your stress environment. Okay. I would also recommend maybe eating several small meals through the day more, incorporate more fruits and vegetables, less sweets through the day. Okay? All right. Well, if you just step out, and then you can meet with them up front and just set up your next appointment.
All right, thank you.
All right. Thank you.